I would like to welcome everyone to the School Turnaround Podcast. My name is Dr. Chance Lewis, and I am so excited today for today's guest, a person that I've known quite a bit of time. I have many stories that I could share, but I wouldn't do that for the podcast, for our listening audience today. But I'm so excited to have her today. Very proud of the work that she has done. But we have none other than Dr. Sonyia Richardson with us today. Dr. Richardson, how are you today?
I am good. Thank you so much for having me.
Great. So as we know, the School Turnaround Podcast is to highlight people I deem great in their respective fields as it relates to school turnaround and different aspects that we need to consider in the education profession that are doing a number of things, or a number of research initiatives, or practitioner-based work that could be an aid in the school turnaround process. So the goal of today's episode is to highlight another facet of school turnaround that we often don't consider, particularly with kids in the school, probably faculty and staff too, but for our conversation today, particularly the kids in the schools that school stakeholders need to consider as well. So, Dr. Richardson, I'm so happy to have you today and for you to provide your expertise with us. So if you could start us off, if you could just introduce yourself to our listening audience and tell us a little bit about your journey, as one of the rising stars in urban education and social work and suicide prevention research in the United States. So just tell the people a little bit about yourself.
Yes, thank you so much. And thank you, Dr. Lewis, for this opportunity. It's an honor to be here. So I am Sonyia Richardson. I am a social worker. So I've practiced as a social worker for over 20 years. I'm a mental health therapist as well. And I'm also an urban education scholar. So I have been practicing in the field. And as I was practicing in the field, working with a lot of individuals and families who needed mental health care, what I was finding is that there were some gaps in treatment. There were some gaps as far as their educational needs. And so I really saw the need to go back, pursue a PhD, was able to train under you. So thank you for the mentorship and guidance. And I've really been able to figure out how to connect mental health, suicide specifically, within urban educational context. So it was a construct that was missing. It was an area that was missing in the research. And so what I was finding is there was a lot of focus on academic outcomes, making sure students were progressing. But if these students are dying, then the academic outcomes don't matter. We have to keep the students well. And so I've really been encouraged by other scholars in the field. I've been encouraged by mentors to really just hone in on suicide prevention, mental health promotion among kids. My research focus has primarily been Black kids. Because the rates of suicide among Black kids for the first time ever are at a highest rate. And so everybody's trying to figure out, why are Black kids dying by suicide all of a sudden over the last 2 decades. And so I'm committed to really interrogating these educational environments to figure out how to help our kids to survive. And then as they're surviving, help them to thrive. And so that's where I'm connecting the urban education with the mental health, suicide prevention. And really, just to tell a brief story, what was happening with me in the community prior to doing research is I was having pastors come to me after a kid died by suicide in their congregation. And I became a specialist in the local region in Charlotte for addressing suicide postvention. So after a kid died, I was going into the church and working with the youth, working with the adults, helping them to process the grief.
Right.
And that's not okay. And so I really wanted to address it on the front end. And so my research has been able to really be more proactive and still work with the faith community organizations to address suicide and tackle some of the educational constructs that are making it difficult for our kids to thrive.
Wow, yeah. I mean, you said a lot, and that's why I'm so glad to have you on today's show. So, in our conversation, just for our listening audience, I want us, if we can, before we proceed, just kind of unpack a few of the terms that you gave. So, you gave us mental health, right? You talked about your work in social work, right?
Mhm.
Suicide prevention and urban education. So
Mhm.
just unpack that for the audience
Yeah.
of what each one of those are kind of individually, and then kind of how
Mhm.
they intersect for our conversation today.
Okay, sounds good. So mental health promotion, if you think about your physical health, it's about your wellness, your overall wellness. So we want people to
Right.
be well.
Yes.
So mental health does not denote mental illness. It's
Right.
being mentally and emotionally well.
Okay.
Suicide. So suicide, you have suicidal behaviors.
Okay.
Is really what I'm tackling. Suicidal behaviors includes attempts to die by suicide, which right now are the highest among Black girls. It's
Okay.
deaths by suicide, so people actually dying by suicide, and that's highest among our Black boys when we look at
Okay.
Black kids. And then there's thoughts of suicide, and so what my research has found as is at a national level, particularly we're seeing it at even younger rates among our middle school students. 1 in 3 Black middle school students has thought about suicide. So
Right.
if you have a classroom and if you take your Black kids in that classroom, 1 out of every 3 potentially has thought about suicide. So suicide is pretty common, but it's not common in school environments. And so when I
Right.
look at urban education and I'm thinking about urban environments and how
Okay.
they tend to have more kids of color, these
Mm-hmm.
are particular environments where you're going to have higher rates potentially of suicidal thoughts and behaviors or suicidal behaviors. And so you're really wanting to tackle these urban educational environments to figure out how do we create environments for kids, for faculty and staff to be well. We want to promote
Mm-hmm.
wellness. And so I think I've touched on those 3. I'm missing one. I don't remember that last one, but
Yeah. Well, yeah. Social work and urban education. Well, you got the urban.
social work,
Yeah. Social work.
yeah,
Yeah.
social work is so important. So social work is all about social justice. So we're
Okay.
focused on advocacy, disruption, speaking out. And so if you follow some of my work, I am I do call myself a disruptor. So I do
Mm-hmm.
call out things.
Right.
And I disrupt to shut down so that we can rebuild. And
Mm-hmm.
so social work is all about social justice and advocacy and advocating for all. But my particular research interest is with Black youth.
Great, great. Well, I'm glad you laid that out for our listening audience to help us understand, because a lot of times, particularly in education, we kind of throw around words like mental
Mhm.
health and all of that, and not having a clear understanding on what that means. So I appreciate that. So based on what you've laid out for our conversations today, let's bring it full circle now and bring it into the school, because a lot of times, I think until recently, you wouldn't really hear about terms like mental health, suicide inside the school, particularly as well. So we know that the school turnaround process of taking a low achieving school and making it a high achieving school is hard work. So, in your opinion, why do so many schools, struggle not only with the school turnaround process, but what role do you think suicide prevention and academic achievement play in that process? Because it seems to me, and I could be wrong, and you can enlighten us on that, a lot of conversations are not had about suicide prevention inside of the school and how that impacts academic achievement. So give us your thoughts of how they intersect inside of that school environment as well.
Yeah, so great question. So when you think about suicide, you're correct. We don't speak about suicide often in school environments, and then within school environments for which there are higher rates of kids of color, there's oftentimes more stigma associated with suicide. So it's not often talked about until a death happens,
Okay.
and then that's when you're trying to go in crisis mode and trying to adjust and accommodate. But when I think about school turnaround and I think about the intersection of suicide as well as academic achievement, urban education, et cetera, what suicide prevention efforts stress is creating safe, inclusive, authentic environments where people can exist and where people can thrive. And
Okay.
so a big component of suicide prevention is safety, making
Okay.
sure individuals feel safe to be able to speak up, to say I'm not well, things aren't working for me, I don't understand what's happening in this classroom. Teacher,
Right.
you're teaching, but this doesn't make sense. And so, is that kid safe enough? And is the environment created to where they can authentically show up as themselves in that environment? And so, when you think about mental health promotion, it's really about creating safe spaces. It's about creating inclusive spaces so that all kids feel like they are included. It's about making sure every single kid thrives in that environment. So, as someone focused on suicide prevention, my goal ultimately, my goal is to create conditions where Black youth can thrive, where
Okay.
everybody can thrive. I want everyone to thrive. And so when you
Right.
think about that school turnaround process, there has to be the intention of ensuring that every single kid in that school has the opportunity and the ability to thrive. And we believe in their ability to do that. I believe in my ability to save lives.
Right.
And so it's the same thing within that. I think also when we think about school turnaround in these environments, it's also about ensuring that there's an environment of wellness. Is Are people well? Are the teachers well? Is the principal well? Is the administrator
Right.
and the administrators well? Is wellness promoted in these environments? Because if people aren't well, then everybody's not going to be well. Like I believe in collective wellness. There's a African proverb that says, "Ubuntu, I am because we are," and I
Right.
take that proverb and say, "I am well because we are well." If there's not collective wellness within that school environment, then it's likely that the kids aren't going to be well, and the kids are going to suffer, and everyone's going to suffer.
Right.
And lastly, I'll say, when I think about academic achievement, I also think about opportunities to thrive from an academic perspective, and also thinking about these kids and opportunities to get access to STEM supports, STEM resources. And so, in my particular research, when I think about Black kids thriving, I'm thinking about what do they have access to? And I'm thinking about how can I help increase their access to a STEM pipeline so that they can get access to educational opportunities, opportunities to innovate and create, opportunities to take advanced courses, AP courses, increase access to those courses. So it really encompasses a lot of those things for me, and that's where that intersection happens for me.
Right. And that's good. I'm glad you broke that down for us. So if I put on my kind of educational lens and I look at a school, if I zoom out and I look in to a school and say, okay, I know this school potentially is struggling with suicide prevention, right? Because there's a lot of things going on with kids in the building, and then we also know that they're struggling with school turnaround. Okay, so if we were to kind of dive deeper into that, and a person may be watching and say, okay, well, how do I know if a kid, is showing signs of suicidal, thoughts, actions, or what have you? What could be some key things that they can look for, educators could look for, that they may want to consider, given our topic today?
Yeah, so great question. So key signs for suicidality is what we would call it. So
Okay.
suicidality among kids. You're paying attention to isolation. However, we know post-COVID,
Okay.
isolation was a major factor, but you're looking at that
Right.
kid that's isolating themselves at school, maybe not going to the lunchroom, not talking to kids there. So isolation. Kids that are
Okay.
victims of bullying. The problem with bullying is now the bullying has extended to social media. So it's high rates of bullying at school, and then bullying in the community or on social media once they go home. So those kids that are experiencing bullying are typically your kids at higher risk. Among our Black kids, it's the kids. We often think of suicide as a focus on depression. So it's we
Right.
think of somebody's really sad, but among
Yep.
Black kids, it's really anxiety. That's the precipitating or preceding event. So anxious thoughts. These are high achieving Black kids. So some of your high achievers is those kids that are in the AP courses, those kids that are struggling. Those are kids that we need to focus on too. Within our culture, I'll say within the Black culture, we know that within our culture, sometimes we push our kids and say, well, you got to work 10 times as hard. Well, guess
Right.
what? That 10 times as hard and that anxiety that we've created has now increased potential suicide risk. So you're looking at high anxiety, worried about the class, worried about this exam, can't really focus, those things like that. And then I would say, lastly, These kids that don't have connections in the community, not connected to maybe a local church, not connected to a Boys and Girls Club, not involved with sports. There's no connections. And so those would be some of the factors that I would pay attention to. They're not talking about, maybe going to an after school program, or if they're in their neighborhood, they're not involved if they have a neighborhood group or neighborhood activity or a gym, they're not doing any type of social activities. Those are the kids that you kind of want to pay attention to because they're not connected. Being connected is important. And lastly, I will say the research is showing racial socialization. Those kids, when you think of it from a race-based perspective, those kids that are, I'll take Black because that's my research, but Black kids who don't understand how to navigate the world as a Black person, those kids are at higher risk because they're not knowing how to deal with discrimination and racism in school environments. Right. And so, when there's the disconnection to your Blackness or self-internalized hatred, those also can create some of those risk factors. So you're looking at, several different factors.
Wow, that's great, and that's very enlightening as well. I mean, because you raised something that I think is important as you described, kind of these kind of suicidal thoughts and actions that educators need to look for. But I never really thought about it among the high achieving students as well. And I could kind of see, particularly in this time of year when they're looking at, applying for colleges and, all of those things, high stress situations as well. So when you look at this, if we zoom out even further, we're in the state of North Carolina right now, and we have over 300 schools in the state that are in need of school turnaround, or in lack of better terms, are low performing, right? And so now we just magnify the issue of what we just talked about from one school to over 300 schools, okay? And so based on your work, okay, what are some things that we can do to properly address this? Because we're going to move towards solutions, because I'm a solutions-based person. But as we dive into the solutions, the first thought before we get to some other stakeholders, I think for the immediate, just so our audience can understand, what is the role of observing these behaviors with the students, but then utilizing the resource in the building? Because most of these schools may have one social worker, right? So maybe not even have that. So how do you utilize the professional in the school?
So great question. So the key with utilizing professionals is to realize that it's not just it's not just professionals in the sense of social workers and counselors and psychologists that might be available in the school, but it's also your cafeteria staff, it's your custodians. Everyone plays a role in suicide prevention, because suicide prevention is really about acknowledging, validating that individual, seeing that person, noticing that person, picking up on differences in their routines. But if there are student support personnel on that campus, then it is the connections. If you have those connections to the social workers, counselors, psychologists, then that would be important. But also the teachers. The teachers play a role in this. And there are resources available to assist. So we know within some school environments, like you said, they don't have the resources. But 988 now is a federal hotline that's available for students. And I know within the state of North Carolina, there's been a push to disseminate the information at all schools, all districts within North Carolina. So the kids have access to the information now. 988 is a crisis assistance suicide prevention line. So like calling 911, you can now call 988. And the beauty of that is that it's free and it's available to anyone. And so I often tell, when I'm out in the community talking to kids, I often tell them, if your parent is not receptive to therapy, because what we find in the research is the kids are wanting help, but the parents don't trust the help for valid reasons. Right. And so I often tell the kids, if you need help, call 988. You don't need parent approval. You don't need parent consent. And 988 will get you access to a counselor for free. And that gives you someone that you can speak to, seek some guidance or assistance from, etc. And then parents can also call 988 with their kids. And so it's a free 24-hour resource that's available.
So
So
it's
there are
988. So it's
988.
988 now. So
Yeah,
it's just 988.
it's just 988. It's like
Oh, okay. So
911,
yeah,
but it's
we'll get
988.
that on the screen so we can,
Yes,
put that out for people as well. So, and it's free.
absolutely. And it's free. And it's
Okay.
free. And in our state, we've been doing some concerted efforts to reach it into communities of color. So now we
Okay.
have flyers and pamphlets for barbershops, for barbers, for faith communities, HBCUs now. We have specific information for them. So it's really getting information out about resources that are available that are free, particularly in schools that are under resourced. So this is just one resource that's available. The other thing I'll say is that research is showing that peers can be really effective in suicide prevention. So I don't want to forget about the role that kids can play. And there are some evidence-based interventions now where they're going into schools and training peers on how to report and say something. North Carolina has Say Something, I believe is what it's called, where if you notice someone is experiencing mental distress or suicidal behaviors, you can report it anonymously and then they'll get a team to intervene. And
Got
so
it.
there are some measures that are being done to help, but we have to use them.
Got it. Got it. Got it. So that's an important resource. I never knew about this, so I'm glad you highlighted that for us today. So let's do the roll call, as I like to call it. So
Okay.
let's dive in on the solutions.
Okay.
Okay. So I'm gonna call off a particular stakeholder, and from your seat, just give us some solutions or recommendations that you think they need to consider from tuning into this podcast that they can immediately implement, let's just say starting tomorrow, because I'm big on that, the easy solutions that are easily implementable, in the environment. So let's talk about school districts and schools. What would be your solutions and recommendations that they need to consider?
So for school districts and schools, I would go right from what we just talked about,
Okay.
dissemination of that 988 information. The information is free. You can get it from the federal government. You can also
Okay.
get it from your state departments of health and human services. Get the information, disseminate the information. And here's the key. The information needs to be disseminated not just in the schools, but in the community environments. So if you can
Okay.
partner with the barbershops, partner with the faith communities, get the information out there. Make sure everybody knows 988. We shouldn't still be saying, what is 988?
Right.
Like, it needs to be disseminated. That would be an easy, low hanging fruit, cost nothing item that can be done to really help promote mental wellness and help with the school turnaround.
Okay, great. So let's go to our next stakeholder. Let's talk about school boards,
Yeah.
local and state, because we know each school district is kind of locally managed by the school board, and then we have the state board, like the Department of Public Instruction here in North Carolina. But each state has their own kind of state board as well. So what should the boards be considering with this work as well?
Yeah. So when I think about school districts, and I'll just take North Carolina for example, when policies are implemented at the state level, what we're finding in our state is that each district can interpret that policy differently. And
Okay.
we recently had some policies that were implemented regarding wellness and the well-being of kids. And so each district was implementing those policies differently. At
Okay.
the end of the day, when I think about solutions for school boards when I think about like school boards and districts, at the end of the day, it's about promoting wellness among all kids within your district. It is not about withholding their right to therapy, withholding their right to having conversations about well being or mental health. It's about making sure every kid in that school environment is able to have a conversation and some education about mental wellness, mental well being, how to assess if something's not right, what to do if something's not right with me. Every kid needs access to that information. And because of some policies that were passed in North Carolina, that was withheld within some districts from schools because the school districts they were afraid of how to implement that policy. So we cannot be afraid to address the well-being of every single kid in every single district, regardless of these state policies. So I would say promote wellness among all kids, make wellness a priority. It's not just about your academics, but it's also about the wellness of these kids.
Interesting. So they were afraid, so they just didn't implement. So that's a
They didn't.
whole nother episode at another time for that
Absolutely.
part. So state legislators,
Yeah.
yeah. So seems like this is a bigger issue. So talk to us about what state legislatures should consider with
Yeah.
this as well.
So that's the policy. So there's conflict now with parent rights and parents having a right to determine if their children get access to information about mental health. And there's the concern about the well-being of these kids, particularly post-COVID.
Got it.
And we know we're experiencing a mental health crisis.
Yeah.
Okay? So when I think of policies at the state level and what our state legislation needs to do is to promote policies that ensure the holistic wellness of kids within educational environments. There are some districts or some states for which they have required suicide prevention, intervention activities. There's the promotion of that. I would also say within that is also ensuring that there's support for these teachers. I've had a conversation recently with a teacher who had a kid who died by suicide. She found out the next day at school that the kid had died. There was no conversation. Nothing ever happened at the school. There were no supports for the kids, no supports for the teachers. And she said the kid wasn't even buried. The kid never had a funeral. And so she's still dealing with the grief that comes with that. That's not
Right.
okay and that's not acceptable because it's hard for her to teach as a teacher when there's no support for suicide
Right.
and dealing with that. And so there has to be some support across the board for our teachers, for our administrators, for our students, our staff, and our parents as well.
Okay. Great point. Great point. So let's look at universities now. I mean, these are the places where many of the education professionals are trained, and I'm willing to go on record to say that most of them are probably not trained fully on this topic, or if at all. So what would be your thoughts on that?
Sadly enough, social workers are one of the top professions for mental health therapists, and we're not trained on suicide prevention. And so I think about certificate programs like the certificate program you have with the culturally sustaining. And I
Right.
think about the need for certificate programs for suicide prevention,
Yeah.
particularly for educators. It's needed. It's needed. Youth rates are increasing, particularly among youth of color. And so there needs to be some training for how to recognize it, how to identify it, and how to address it.
Well, maybe you and I need to talk about that further
We do.
to make that happen.
Absolutely.
Yeah, we can make that happen. All right. And then, so parents, talk to us about that.
So for parents, and this is specifically for suicide prevention, and this is the easiest thing that parents can do, low-hanging fruit, reduce access to lethal means in your household. And what I mean by that is you reduce access to items that can increase, that are easily accessible for your kids, that increase the likelihood that if they're thinking about suicide, they follow through. For example, I tell my parents, make sure you don't have ropes hanging around your house. Get rid of like long strings and things. Make sure your guns are in lock boxes or that they have gun locks. Put those away. Make sure they're not accessible. Your medications. Make sure your medications are put away. Make sure they're safely secured. And I have children who are adults now, and I still reduce access to lethal means within my household because I want to make sure when it comes to suicide, a person can make a decision to die by suicide in less than 5 minutes. So if there's something easily accessible in your house, they're more likely to die. So just reduce those access to lethal means.
Got it. Got it. Got it. So to summarize our conversation today, it seems to be that this connection between this educational process with school turnaround on one side and then the well-being of the students, on the other side, seems like there's a big gap in between, what we're charged to do in education and then the clients we are serving as well. So hopefully today's episode will be a bridge to having those conversations in schools and moving forward with that dissemination of information like the 988 you shared with us today to start to enlighten and inform, schools and communities around that. So before we close out, I'm so proud of you and the work that you're doing. So if people wanted to follow your work, how can they get in contact with you? Let them know where you are, who you are, all of that good
Yes. Yeah,
stuff,
I
how
never
they can
said. Never said.
right, make a connection with you as well.
Yes,
So,
thank you, thank you. So full time, I'm assistant professor in the School of Social Work and the School of Medicine, Department of Psychiatry at UNC Chapel Hill. So you can locate me there. I am on LinkedIn. You can follow me there. I post my work there, but feel free to reach out and connect. I'm happy to have conversations.
great, great. Well, I want to thank you so much for your time today. You definitely added to the richness of our conversations through this podcast as well. So hopefully our audience will listen, take heed to what you said today, and definitely reach out to you to tap into your expertise even more as well. I'll definitely be talking to you about that certificate program as well. But just thank you again. I'm honored to have you on the show, and great work, and continue to do the great stuff that you're doing. Okay.
Thank you so much. I'm honored as well.
All right. Take care.